good morning, good afternoon, good evening, wherever this video meets you. Yes, this is a video about the different kind of healthcare rules that we have. I'm actually making this video because of a friend. I had a discussion with a friend some weeks ago. I also have done this video, but because of time constraints. Anyway, I had a discussion about my friend who we happen to work together in the healthcare sector. Let me put it that way. And we're talking, but I just found out that a lot of people don't even know the different kind of job roles that are in these healthcare jobs. So with this video, I'm just going to dwell mainly on just two of them, which is the support work and the healthcare assistant. But I'll be mentioning the different kind of job roles that are in this healthcare sector, which people can diversify into as time goes on. So now, what is the first thing first? The first thing is a healthcare professional. What's the definition? A health professional or a healthcare professional or a healthcare worker is a person that provides care, healthcare treatment, and advice based on formal training and experience. So it now depends on the level at which you want to go to. Like we all know, we have the healthcare workers starting from the GP, that's the general practices, the general dentist, we have the nurses, the physicians, and all that. That's like the main aspect. So now we now have different ones, different support roles, different job roles that one can do, which include the ambulance and care assistants, the call handler, cardiographer, creative therapy support roles, pharmacy assistants, phlebotomy, different one, dietetic assistants, dental support worker, physiotherapy assistant, physiotherapy, radiography, different ones. I'm just doing this video for the sake of those that just want to do something like in the healthcare that doesn't want to work in a care home or something. So now, but this for the sake of this video, I'm dwelling on just two roles, which is the healthcare assistant and the support worker. So now, who is a support worker? A support worker is a person or an individual that works in a care setting that focuses primarily on the overall quality of life for individuals, and they focus mainly on the independence and social inclusion of the person. Then the main job is to support individuals with physical disability, mental health issues, learning disability, or those in social care. Then the responsibilities, what they have to do on a day-to-day, include assisting with daily activities such as cooking, cleaning, shopping, and transportation. They provide emotional support and companionship. They encourage individuals and help individuals to achieve personal goals. Like, let's say, for instance, if you want to learn a new skills or access an education or employment. So some support worker does all this. Then the work environment, they work in a typical work environment that is like a community setting, like a supported living or in the client's homes, rather than clinical environments. If you know, like a support worker is not like the clinical place, like it's not a clinical environment. They work more like in the people they support home or in a supported living. Then the training requirement, they may not require any formal healthcare qualification, but training in safeguarding mental health disability or mental health disability care, like all those short courses, not like working in a clinical setting. And if you look at it, most support workers, they give medication, and which is why they undergo that training too. So now let's look at the healthcare assistant part. An healthcare assistant, they involve in direct medical and clinical care, assisting in healthcare profession. They assist healthcare professionals such as the nurses and doctors. They focus mainly on improving an individual's physical health and meeting the basic medical needs, rather. Then the responsibility now, they assist with personal care such as bathing, dressing, feeding, even toileting. They monitor the vital signs like the blood pressure, the temperature, the pulse, because healthcare assistants, they work mainly in a care home setting, in an hospital setting. They work in collaborations with nurses, and some healthcare assistant jobs are also known as the nursing assistant roles. So, and what things they do again is, like healthcare assistants, they help patients with mobility and transferring them between beds and wheelchairs, or from chairs to bed, as the case may be. They prepare medical equipment to assist with minor medical procedures. That's when in a clinical or in a hospital setting. Then the work environment is mainly in a healthcare setting, such as hospitals, nursing homes, or clinics. Then the training required, most of the basic health care training, they will ask for the 15 standard care certificate, which they also ask for in the support worker, but it is not as mandatory as it is in the health and social care work, which is, they also ask for the NVQ. Some roles may require special training and in infection, such as special training in infection controls and clinical procedures. So now the key difference is just that focus on support workers. Support workers, and they focus more on social, emotional, and daily living, while healthcare support workers focus on physical health and clinical tasks. Then the environments where support workers are based on community. They work on community, where healthcare assistants working in medical or care facilities. Then the skills entails healthcare assistants require medical related skills and training, while support worker needs communication, independent, and support and social care. Despite this distinction, both roles are vital in person centered care and improving the individual life. So, with this case, like for me, like my general conclusion about this is that healthcare assistants jobs roles, they are not as tedious as it is as working as a support worker. Support worker, you don't even need to do some certain, like you don't need to give some personal care or go into the intimate, like if you get what I'm saying. But as a support worker, as a care assistant, you need to like think more like you're in a clinical environment, which is not needed in the social working as a support worker. So I think this video is I just made this video just to have a just a pre-knowledge, like a knowledge, general view of what it is to be a support worker and a healthcare assistant. Let me know what you want me to talk about next in the comments. Thank you very much for taking your time to watch this video. I appreciate it. Thank you. Bye bye. See you again. It's your lady, your girl, your friend, Obashui Hex. Thank you.